Hello and welcome to the Pain Perspective podcast. I am Nikki, one of your hosts, here with my husband, the one and only Dr. Ashu Goyle. And together we are here to share real and organic conversations from people who have experienced pain, whether it be emotional, physical, or mental, and how they overcame it and created a life they love. We will also be sharing conversations with experts in the field to give you the tools and resources you need to live the healthiest and happiest life possible. Our hope for you is that you hear stories that will change your life and give you hope for the future, that you will walk away feeling motivated and like you can take on the world. Now grab that pen and paper. It's time for the Pain Perspective podcast. Welcome, Andy. We're here today with Andy Moriarty, and he is a local physical therapist in Scottsdale. And we're here to talk about the importance of physical therapy and just kind of learn about you as a person and also as a physical therapist and kind of what you're doing to help people heal. So thank you for coming. I appreciate you taking your Saturday. Yeah, you're welcome.
Appreciate it.
Let's just start right off and just tell us about you. Where are you from? How did you land in physical therapy, and just give us a little behind the scenes.
That's a great story, actually. I was born and raised in Tucson. Both sides of the family are from Chicago.
Okay.
And the story of how we ended up in Tucson is kind of funny as well.
Mm-hmm.
But I'm the son of a dentist. And as a young kid, my mom had really bad, what they call TMJ back in the day. We now call it TMD for temporomandibular dysfunction. But my father had a friend in the Arizona Dental Association, and the only person in the state that treated this.
Mm-hmm.
And so I would come up as a kid. I was 6 or 7 years old at the oldest, and we would come up, see the dentist, and my mom would go next door to a physical therapist. And as a young kid, textbook mama's boy, I was absolutely, the impression it made on me by this therapist was life-changing.
Interesting.
So I saw the benefit it gave my mother. And
this was for TMJ.
Wow. TMJ specific.
Okay. I didn't realize that TMJ could be used, like physical therapy could be used for TMJ.
Yeah. And then that's later in the story, exactly. how that turns out. But I was always amazed at how much better she felt. And there's another level to it. When I was in preschool, a family moved from Los Angeles, and it was holiday time. Mm-hmm. They were new to the city, and my mom said, "Hey, come enjoy the holidays with us." Well, since that time, our families are very, very close. We celebrate most holidays together, and he was a physical therapist.
Okay.
And anyone who knows dentists know they have terrible back pain. And so I had this twofold influence. I had someone who was keeping my dad feeling okay so he could work. Okay. And I had someone up here in the valley that was helping my mom.
Okay.
And so as a young kid, I knew exactly I was going to be a physical therapist.
Oh, wow. Wow. So how old were you when you knew this?
I was 6 or 7.
Mm-hmm. Wow. You knew that young. Mm-hmm. It was like a calling for you.
Exactly.
Wow.
And so about 21 years later, I became a physical therapist and never wavered along the way. I did internship programs in high school. I was 12 years old the first time I volunteered. I went down to Nogales. There's a children's clinic where physical therapists would bring kids over the border. Mm-hmm. And since that time, it's now full medical. So it's the first Tuesday of every month. I try to go down there every so often. And I like to take my support staff because I think it's important for them to really see the things we take for granted. Mm-hmm. Think about, we see third world healthcare coming across the border.
Exactly.
And we're a part of helping that.
Now, when you go down there, so what are you guys doing? You're helping?
It's mostly pediatric.
Okay.
But we're helping with gait, strength, walking, helping with transfers. We built wheelchairs, all kinds of things you do. It's a really neat program. And if anybody's interested in volunteering, I can connect whoever, with the crew down there. So really good. I haven't been in a couple of years because of COVID.
Yeah.
But then the story continues. Okay. I was volunteering in high school. And then in college, I spent some time volunteering at a local high school, a local hospital, working with inpatient rehab. And all the while, planning on going to PT school, taking all the prerequisites, got into school, moved to Florida. We spent 2 years there, and we originally, I got married about 2 months before PT school started.
Okay.
And so, I can absolutely, say that my success is definitely because of who's supporting me. I owe it all to my wife, Cheryl.
Oh,
She is 100%.
I love your wife, Cheryl.
Well,
She's
meeting her
as do I.
fantastic. Yeah.
So she was instrumental in that.
Yeah.
And the funny part about that is that she has a background in marketing and finance.
Okay.
And so she was actually the marketing director of my school.
Oh, wow.
So she's on a first name basis with all my professors.
Oh, wow.
It's kind of fun.
Yeah.
And afterward, we moved back. We moved to the Valley, and then we ended up going back to Tucson again to start our family.
Okay.
And then her career had a great opportunity, and that's what ended up bringing us back to the Valley here.
Okay.
And so, yes, we make a lot of trips to and from Tucson, and that's okay. We knew that when we moved away.
Your family's still there?
They're all
Okay.
there. We're the only ones who have left.
Okay.
They're all down there.
Okay.
As a matter of fact, we have a son right now in college at the U of A.
Oh, okay. Great.
So it's been a wild ride.
Yeah.
But as my career went along, I ended up going to my particular PT school because I was working at this close family friend's office as a PT tech in the gym.
Okay.
And when the school opened, they reached out to all their graduates, or it was initially just a continuing education institution. And they reached out to all the people who had this particular certification that I knew about because I was around this practice and this person growing up. And I said, I don't know what those letters MTC are, but I'm getting them.
Yeah.
And so they ended up calling all the people in the country who had this particular certification to take students. And so when I was working there, one of the students in the very first class was doing his outpatient internship at the office.
Wow.
And at the end of the day, the particular student ended up winning the award for the best manual therapy skills in that program.
Cool.
And I was pulled into the clinic owner's office and said, I don't know what's going on in Florida there, but you must apply.
Yeah.
And so that was how I ended up going to Florida.
Okay.
And so I got out of school and I immediately started taking those classes because I didn't know what those MTC letters were until I got to PT school.
Yeah.
I knew I was getting them. So I did end up getting those.
Okay. And what are the MTC letters?
It's manual therapy certified.
Okay.
And so I went through, it's essentially 7 continuing education courses. Then you go back and get tested, written, oral, and practical. And then we have to maintain 30 hours of continuing education units or hours every 2 years to maintain that. And so that's kind of my start of manual therapy.
And so then you started once you guys moved up to the Valley, then you started working as a physical therapist. And did you specialize in anything in particular?
I was working in sports medicine, which I still do.
Okay.
And I slowly honed my practice in on those areas that were of interest to me. And I like complexity. I like things that are complicated that make you think.
Oh, yeah.
And so the spine was kind of where I ended up.
Okay.
There's so much happening in the spine, as you're well aware.
Absolutely. Yeah. We share some very complicated patients.
Absolutely. Absolutely. And I have a knack for connecting with that particular group of patients. And, I think it's important. People can be good at a skill or treating a body part, but not having the ability to connect with people.
Right.
Exactly.
You have to be able to connect.
Yeah.
And so I just have that ability.
Which is nice.
Yeah, and I can attest to that. I've known Andy for 14 years now,
Or so,
a little over 14 years. Yeah, since 2008.
Yeah.
And his ability to connect with patients is so authentic and genuine, and he really empowers them to be their best.
Well, we can't do it alone.
See that.
I mean, we have to. We're a team.
Yeah.
I mean, you and I are a team.
For sure.
And when patients know that we communicate, they're involved in the team, and it's incredible that the outcome.
Yeah.
And you can take people who you don't expect much progress, and suddenly they're making huge gains. But there's a team behind them. So,
Yeah, absolutely.
Well, and I feel like you both kind of have the same mindset as you really just care about the patient and the outcome and them returning back to their quality of life.
yeah. We're in a
Which is
unique
great.
situation too, because we have the chance to get to know our patients.
Mhm.
And we know what motivates them, what drives them, how they were injured, what they want to get back to. And you only get that by listening, by intently listening to what people say.
But Andy, you and I want to do that.
Yes.
Unfortunately, there's a lot of practitioners out there who don't want to connect with their patients. And,
It's
I
a
think
surface, more of a surface.
Yeah, more of a
level.
surface.
Yeah.
I'm the provider, you're the patient, and
Yeah.
that's the relationship. Where I think where Andy and I approach this completely differently, where we're a team. We're truly a team. And we want to know you. We want to know what your goals are, what got you here, and what's limiting you from getting to where you want to get to.
Yeah.
Absolutely.
Yeah.
I give all my patients my cell number.
Wow.
I get the occasional text here and there. And sometimes if I have somebody that I'm worried about who I treat on, Friday that I won't see till the next week, I will ask them, please reach out to me sometime this weekend. I want to know you're okay.
I love that.
And it's amazing how much people care, how much you care.
Absolutely.
And it just takes healthcare to another level.
Yeah, because you really don't see that. I mean, I even personally haven't really experienced that type of care when I had an ACL injury and I had to do physical therapy. And I mean, I would go to my appointments and they were great, but I never had somebody, here's my cell phone, text me, call me, I want to see how it's going, I want to see how you're doing, let me know if you have questions. That is taking healthcare to the next level.
Well, people don't come to see us because they feel great.
Right.
And a lot of times what we do does cause discomfort.
Yeah.
And I think if we have the right environment and the right people and a friendly, encouraging environment for progress, that a lot comes out of that.
Yeah.
Absolutely.
There's a lot to be said for it. And once again, our ability to communicate is huge for patients.
Yeah.
I get a lot of feedback from people. They're worried about what happens if there's this complication. Don't worry about it. I can text Dr. Goyle. No problem. And that there's a lot of comfort with that.
Absolutely.
And it really, it matters.
Yeah.
It really does.
Yeah. I think it puts patients at ease knowing that, you guys are communicating back and forth and knowing that they don't have to worry about anything. You guys are kind of doing the worrying for them.
Right.
Yeah. Which is nice.
Absolutely.
Yeah. And I feel like a lot of patients, just the community, like how you and I communicate about, the clinic and when people are coming in, I don't think patients really understand the benefits of physical therapy and really what physical therapy is used for. And so maybe you can kind of educate us on, why should somebody go to physical therapy if they're in chronic pain? And I think one main question is this going to help me reduce my pain? Is physical therapy going to really help?
Well, that's almost a loaded question because some people come in the clinic and they're very pain motivated, where others are function motivated. I get people that come in and will say, please get me out of pain. Whatever you have to do, just get me out of pain. Yeah. And others say, I really want to golf. Yeah. I need to golf.
Right.
Okay. Yeah. All right. And so I try to, and once again, that goes back to intentful listening. Yeah. I mean, really hearing what people have to say to know, is this person pain focused? Are they function focused? And that's what I do by asking so many questions. And then of course, with experience and as you do the same thing, people will start going down a certain path. And it's important to listen to the cues to follow that path.
Absolutely.
Because that's we have to find their page. We have to meet them in their space. And that really, once again, that matters. Yeah. Because then they know that you're with them. Because it's their journey. Yeah. We're just helping. Yeah. I like to tell my patients that they're the ones on the field scoring goals. Right. I'm just coaching from the sideline.
I love it.
And I think that's important. Yeah. Because they're the star. We're not the stars. We just work behind the scenes.
Exactly.
So I do that with my staff as well. I want them to shine. Yeah. Because you have to be surrounded by good people that you trust.
So if somebody is experiencing pain, what are some things that physical therapy can help them with?
A lot of it comes from mobility.
Okay.
And sometimes deconditioning. And so the key is get a full assessment, find out where they're limited functionally, what their pain is, how they move. Are they afraid to move? Some people are terrified to move. And teaching them that it's safe and it's okay is important. Okay. So we always take a comprehensive approach and we screen everything out. And so that's really what we're looking for. Okay. And so people who are pain focused, we're going to, the verbiage might be different, but we can get this moving more. This will reduce your pain. Okay. And then here are other things you can do on your own to help with your pain. We work in an area with a lot of golfers. So several years ago, I went and I got certified through the Titleist Performance Institute.
Okay.
Oh, yeah, I
So
know this.
I'm able to look at someone's mobility and do a screen specific to what they call TPI, Titles Performance Institute. And it's funny, I can say, yeah, you're probably slicing the ball based on how they move.
Oh, wow.
Now, I'm the first to tell you, I'm a terrible golfer.
golfer.
But once again, it's tying the musculoskeletal restrictions. And so I do see a lot of that.
Okay.
And that's an important thing. And where it pertains to where you and I cross over so much with the spine is explaining to people that during the golf swing, your low back is not supposed to twist.
Exactly.
The areas above and below have to do that. So if we're lacking thoracic mobility or hip mobility, it's got to go somewhere.
Absolutely.
And so it's kind of tying it together.
Absolutely.
And that's an interesting thing. But once again, you don't get there unless you're listening and following that patient down their path.
Right.
Yeah, I think you nailed it when you said you've got to meet them where they are.
Yes.
Like that's really what the key is, I think, to connecting with people and learning what we can do to make them better.
Correct.
Yeah, or give them the tools to get themselves better.
Absolutely. Yeah.
It's fantastic.
No doubt.
Now, as far as physical therapy, can this ever be used as like a preventative measure? I know we've kind of touched on this a little bit, but I think that just what I have learned over the years from physical therapy and kind of the importance, because again, being a patient myself, when I was younger, I didn't really see the importance of it.
Right.
And then now being educated and informed on what physical therapy is, what it's actually doing, and then even having my own experience a second time and seeing a completely different progress from, so I'll just give you behind the scenes. I tore my ACL when I was 18, had surgery, didn't really go to physical therapy. It was, okay, insurance covers 3 months. The doctor told me you should go. I went, and then they wanted me to keep going, but I didn't really want to pay for it out of pocket. Didn't think it was important. Had my recovery was not great. I mean, I had pain in my knee for years and years. And then fast forward to my 30s, I tear it again. This time I'm married to you, and you are explaining the importance of physical therapy. And so then I went and I did it, diligently. I went 3 times a week, and I made sure I was doing the exercises at home. And I would say that my experience the second time was completely different and so much more successful. I mean, I was out of pain within a year, and I don't have, knock on wood, pain in my knee.
Right.
And so it makes me think about preventative. Are there things that people can do and use physical therapy to not only get out of pain, but then to help prevent pain in the future?
That's actually the goal. The goal. So my patients consistently, I tell them, I'm treating you today, but I'm preparing you and giving you the tools for tomorrow. Tomorrow could be next month, next year, or next decade. And I'm very specific about that. And I probably use that line with every single patient. And it has to do with the fact that on the first day I see people, here are a few things I want you doing at home. And the majority of us are in front of computers. I give everyone an ergonomic setup so they can look at what their workstation. Occasionally patients will send me a picture of their station changed up. It's kind of fun. Cool. And once again, my cell number is stapled on it. And so what happened with you also is that as we get older, the ante gets higher. Right? And when we're young, we're invincible.
For sure.
And so I don't think we take it as seriously. But as we get older, we want to live healthy. And people in their 30s want to try to be as healthy or strong or fast as they were in their 20s. And of course, those are the people we see getting hurt in their early 30s. I'm guilty of that too. And when people hit 40, then they start to realize, wow, I need to pave a good path for long-term health, because now they're seeing their parents get to that phase. And I'm an adult child too. I'm in the sandwich generation technically. I'm looking after parents, and I have 2 kids, one of which is rehabbing an ACL tear right now.
Wow.
And once again, so I'm seeing some of those pain issues and whatnot. But absolutely. The preventative side is huge. The problem is that with physical therapy, we typically don't see people until there's an injury.
Exactly.
And so social media has actually helped us quite a bit. We're able to reach out to patients, and we build databases, and we have followers on Instagram and Facebook. I work with a company that has just excellent digital marketing. So we have that resource.
Yeah.
And so we're able to reach people, and it does matter because then people can identify it sooner. As you and I both know, the sooner we intervene, the better the outcome.
Absolutely.
And the sooner that patient's out of pain.
Right.
So, and those are important things. Yeah.
Well, and then another experience that I had along those lines is, I was having neck issues, a couple of years ago. And in my mind, I put it off. And then I was talking to you and you're like, maybe you should go see Andy. And so I went, and in my mind, I'm thinking, oh, this is nothing. Like, it's just going to go away on its own. But it was amazing working with one of your physical therapists and having her help me with my neck completely changed everything. I mean, because I was starting to get like a little vertigo, and I was, and it came down to the way I was sleeping at night. Because then I was starting to get pain down my shoulder. And so just doing these exercises and going to see her for a few months, and that's really all I needed. But it completely changed, and I haven't had neck pain since.
But once again, you were also given a lot of tools to manage it, and now in today's day and age, we were not built to sit at computers.
Right.
Yeah. Our bodies do best. Devices are terrible. We were built to be, farmers.
In motion.
We were designed to move, and sitting still for so many hours is tough. And of course, as you saw, posturally, it makes a difference when you're sitting with a forward head or your sleeping posture is wrong. And it takes a sharp therapist to be able to kind of dissect the layers of the onion to identify what it is. And the therapist you saw is phenomenal. An amazing therapist, and was able to do that. But once again, it occurred because she listened to you. She got down to the bottom of what's going on here. And now, like you said, very well.
And it wasn't something that happened overnight either. And I think that's what, patients probably, it would be good for them to understand is it's not like you go in for an appointment, they give you all the tools, you guys give us all the tools, and then we're fixed. I mean, I would say it took a few appointments before we really figured out what was causing the issue. And we started, it was almost kind of like you said, peeling away the onion. Okay, let's try this. Okay, let's try this. And, in the meantime, I'm doing all of my exercise. But then after she was listening to me, and she was asking me questions. Okay. And then it got to the point where we were even talking about how I'm sleeping at night, what kind of pillow I'm using. I mean, she was so thorough and detailed, which is so nice because I haven't experienced treatment like that in the past.
And I think when you're dealing with any kind of neck or back pain, sleeping position is imperative. It must be addressed. The question must be asked and then educated. Because the majority of people do not sleep in the proper position.
Exactly.
The vast majority of people do not.
Along those lines. Okay. I was going to say, they have to be educated. What I tell patients when I send them to physical therapy, I tell them, you're going for an education. You're learning how to move your body. You have to learn how to use this body that you're given, because right now what you're doing isn't working.
And it's amazing how we see compensations. It sounds corny, but sometimes I'll use the example of a car. To make it for your car to run, there are several different systems that have to interact and work together. And if one of those is not working, it's going to draw power or it's going to change elsewhere. And so the body's really the same way. And so we have to be aware of that. And of course, talking about your neck, I'm fascinated by the neck, the neck, the TMJ, because they're so complicated. So many things happen, and the patterns are different, the pain patterns. And so to me, that's fascinating. And I really enjoy that. And I actually went back and got an additional certification back in 2015 of just the head and neck. And not knowing how that, I went into it thinking, okay, I started my career focused on the TMJ, and I really want to perfect that or get more involved. So I found an organization and got involved in that. And there was so much involved with the spine, with the neck. And then, granted that I had a solid foundation of the neck, brushed it up, took it to the next level. And then, funny enough, that got me involved in some study groups. Now I'm involved in headache medicine. And so and a lot of that is tied to sleep. And so once again, it goes full circle. going back to those habits and helping with an awareness. You know, people talk in my field, we talk about the best fall is the one that never occurs.
Right on, exactly.
The best, headache or neck pain is when you avoid it. And so we try to teach those skills.
Yeah. Now tell us more about the TMJ, because I find that fascinating. Again, like going back to the beginning of our conversation where you're telling us that physical therapy can be used for TMJ. I mean, I know you know all about this, but for me, I never knew that those two, went together. So tell us a little bit about it.
Absolutely. And because it's the reason I'm a therapist,
okay.
It really is a passionate thing for me. But the interesting thing is people don't ever think about their TMJ until it's dysfunctional, until they have their jaw locked open or closed, or suddenly they're having all kinds of pain. They don't know where it's coming from. And so it's not uncommon for people to have ear or jaw pain and they go to their primary care or they go to their dentist, then they go to the ENT, then they see a TMJ specialist, or they go to pain management. And it's funny, physical therapy, in many cases, I'm the last in line. And I'm the one that gets to know that patient the best. And so I'm able to tie in a lot of these things. I have so much face time with patients that I get to ask questions. And so learning about that joint, it's very complicated. So most joints have some sort of stability. The shoulder, ball and socket, the elbow, the knee, more of a hinge. But the TMJ is actually, imagine two soda cans, both convex surfaces rolling on each other. There's no stability. And so the stability is created with a biconcave disc that sits between the two. And oddly enough, there's one capsule around there, but it is separated into two separate compartments. You have an upper and a lower compartment. So we can qualify the mobility of the joint based on what compartment it's occurring. But people who have degenerative changes of that disc, those compartments communicate. And so communicate meaning the disc is perforated, so fluid can go up and down separately. You can get arthritis of the TMJ, no different than people have arthritis of their knee. We see PRP injections. We see all kinds of different interventions to help that. But one of the baseline things is mobility. It goes back once again to mobility and people having a fear of movement. And so we do suggest softer foods, or if someone sprains an ankle and has ligamentous instability, we put some kind of a brace on them. We do the same for the jaw. We use the teeth with splints that can give that jaw support. There are a lot of ligaments around that joint. So in physical therapy, we like to say a joint is a joint is a joint because they're all the same, just a little different. And so, and the way the TMJ works, it's very closely related to the cervical spine. We see a lot of people who come in with neck pain with no TMJ dysfunction, but we rarely see it the other way. Same with the shoulder. We see a lot of people come in with shoulder pain, we have neck pain with no shoulder issues. Rarely do I see a patient with shoulder pain who doesn't also have some type of a cervical component.
Interesting.
And so once again, as you experience, we look at all those areas. We screen out the neighboring joints and we ask questions to find out about habits and whatnot. Ask everyone what kind of work they do and, to get an idea into their life. Have you had any previous head or neck injuries? Tell me about medical history. And a lot of people say, wow, you're the first person that's asked me that.
Wow.
It's phenomenal. And here, in many cases, physical therapy in general is kind of the last on the list of the providers people see. And we're the ones that have the most time to listen. And we tend to be real personable anyway. It's kind of a theme amongst physical therapists. We're personable. We like people. We're just gregarious. And it helps. So.
Well, and that's a main reason we wanted to have this conversation with you, not only because we love you, but also just to shine a light on what you're doing. And so people can be informed and educated on physical therapy and all of the benefits that it has.
I guess if you were to sum it up, I'm trying to perform meaningful work that changes lives.
Right on.
I love it.
I really, that means a lot to me.
You are doing
it. Means a lot to me. And I will say that I'm supported. I have a great structure behind me that allows me to do what I do, and I'm very proud of it. And so that's always nice too. Of course, those of us in healthcare, the bane of our existence is all of our charting, but you know what? You got to do that if you want to help people. And I couldn't imagine not helping people.
You're born to do it.
Absolutely. It's always nice. I know you have the same thing. you get, you see one family member and suddenly they send their friend.
Oh yeah.
And then their friend sends their neighbor.
Right.
And you build this network
Community.
of people this community that rely on you. And then they start texting you, hey, do you know a neurologist? Absolutely. What's the problem? We have our different people we get to know. And then that network grows, and it's all built on trust. Because we sat and listened to our patient.
Exactly.
It's putting the care in healthcare. It all goes back to that.
But trust is so important. I always tell patients, like, whoever you go see, make sure you get a referral from someone that you trust.
Absolutely.
Because they're going to have your best interest in mind.
Of course, in our day and age, we have another challenge. The Google reviews, right?
Oh yeah.
It's always interesting. Here we are as healthcare providers with higher education, being compared next to restaurants and bars. So I struggle with that, but the reality is that if we give 110% of ourselves to our patients, it works.
That's what
it really does.
And I think that, translates over to the patient, and they feel that, because I feel like that is not the norm anymore, and I feel like it's refreshing when you do meet a provider who truly does care and has, I can just see the passion just like coming out of you for what you're doing.
We all do that.
Yeah.
All three of us. That's why that's one of the reasons that we connected so many years ago. So we share that passion.
It's genuine, it's authentic, it's real.
One of the questions that I get whenever I refer people anywhere, the question I get is, would you go there? Absolutely.
Yeah.
Likewise.
I couldn't do that it wouldn't be right. I have my list of people. Well, they don't take my insurance. I will. I have my network. I'll find it. But I think it's important that you have to be in a situation where you can lean on the people around you if you needed the help as well. And patients, they ask that question. It's important. That's more important than any 1 or 5-star review.
Absolutely.
Would you go yourself, or would you send a family member?
I know that's a question that I've asked because, dealing with some teeth issues, and I asked my dentist, my periodontist, who would you go to for a dentist? Because I trust him, and I trust he's super smart. He's fantastic. And I know whoever he goes to, and he's like, all I'll tell you is where I send my family. And that says it all. That's what you do. And so if he sends his family there, then I trust it. And the person he sent me to was fantastic, fantastic. So I think it's the same thing. When you truly trust your provider and then they refer you to somebody, and you feel comfortable and you feel, that you're safe.
Another question that I receive a lot from patients when I'm talking about, okay, I want to send you to pain management. Well, back in the day, 14 years ago, there weren't a whole lot of pain management docs around. And now they're everywhere.
There's one on every corner.
They're everywhere. And so there's this, they say, well, are they going to be wanting to inject me? And I can say, well, I'm going to send you to someone who will listen and find out exactly what's going on, get imaging, and create something specific to you. Because I think that's another thing that people want in healthcare is that it's very cookie cutter.
Right.
And we personalize everything.
Yes.
You can't cookie cutter any patient we see. They have to be personalized, individualized. It's got to be, that treatment care plan has to be specific to that patient only. And so what I like to tell them, especially with you, is that I say, hey, he's going to take care of you. If he needs to inject, he'll inject. If he doesn't need to or doesn't think it's going to work, he won't.
Exactly.
And I think that gives a lot of confidence walking in the door.
For sure.
And that's a good thing. It's a good way for us to get people to buy in. Because in many cases, they've already been down some kind of a pathway in that respect. And, fortunately, I don't get well, what's this one going to do that's different? Because they haven't seen as many. But physical therapists, they do. They end up seeing quite a few. And there are some therapists that are more exercise-based and some that are just hands-off. And then there are those of us who are right in there. One of our company tagline is, hands-on therapy that gets results.
That's great.
It's important. So, and that's one of the things that I do when I'm sending people your way is that I can let them know, hey, if he needs to inject, he's going to. But he's not going to if he doesn't think it's going to help. It's not going to waste your time. And you're going to find someone who's going to listen to you. And that immediately they light up.
Absolutely. Yeah. And a lot of times by listening to patients, you figure out what they need. I tell everyone, you're here. Everything's elective. I'm not curing cancer. I'm not saving your life. Yeah, it's quality of life, but you get to choose what you want to do. Here are your options. And I think that really helps patients, number one, feel more comfortable. Number two, own their healthcare, which is huge.
Right.
And then number 3, be comfortable with whatever path we take,
Yeah.
and know that it can change.
Correct.
Yeah.
And also when people walk in your office, I always get feedback about how amazing your waiting room is.
Oh yeah.
Oh, good.
Nikki did
Always.
that. Yeah.
Always. People walk in.
I
Wow.
love it.
It's so different. It's relaxing. It's welcoming.
Yes.
And I hear that a lot.
Mhm.
It's great.
Yeah. That's what we wanted it to be different. We wanted it to feel, I mean, how often do you go into a doctor's office and it's cold and sterile? And if you're somebody who doesn't like going to the doctor, you get nervous and it just makes you more nervous.
Mm-hmm.
So we wanted an environment that is inviting,
Absolutely.
it's comfortable, it's peaceful, and people feel like they're just at ease before their appointment and not on edge, waiting. We want them to be relaxed and,
like they're in our living room.
comforting.
Yeah.
You've succeeded for sure.
Yeah.
No doubt about
Yeah,
that.
exactly.
Thank you.
Yeah.
And your staff is so friendly too.
Oh,
Yeah,
yeah.
we are
We
so
love our
blessed.
team so
We love
much.
You
our
have a great team.
They're so
They're
great.
phenomenal.
Yeah. Yeah. Yeah.
Grateful every day for those people.
Oh, for sure.
Yeah.
We're as good as the people supporting us.
Exactly.
Our jobs.
And they genuinely care. They
Mhm.
have that thing
Yeah.
you can't teach people.
Yeah.
Either you have it or you don't.
Yeah.
Right? Yeah. And they've got that authenticity.
Exactly.
Yeah.
Exactly.
I don't know about you guys, but I am getting hungry. Shall we move over to
Let's
the
do
table
that.
and have
Absolutely.
lunch?
We'll get to meet your beautiful wife.
Yeah.
Absolutely.
Yeah.
Yeah.
Fantastic.
Okay, everybody, we're here with Cheryl now. Thank you so much for joining
Thank you for having me.
the conversation. But I made an anti-inflammatory meal. So it's basically like a Middle Eastern lentil soup. I had some leftover marinara from the week. So I basically just cooked some lentils, added the marinara, and then there is harissa, which is like a red chili kind of paste. And so I put that in there. There's an egg on top, and then we pickled some onions. There's some carrots, garlic, jalapenos, and then this is a pear and gorgonzola salad. So dig in.
Fantastic.
Yeah,
But
this looks
I hope you guys
amazing.
enjoy.
And it smells even better. The aroma was intoxicating.
Thank you.
I've been seeing all these recipes on your Instagram.
Yeah.
And now I actually get to experience that. We're excited.
Mhm.
I'm so spoiled because I eat this every day.
Oh, you are
Yeah,
spoiled.
I've got patients
Yeah,
who-
you're living the
awesome.
life.
I've got patients
Yeah.
who come in and like, wow, your dinner looked really good last night.
Mhm.
I'm like, which one did you see? I was like, oh, no, that's from 2 nights ago. I was like, you haven't seen what I had last night. It's coming.
That's awesome. That's so funny. That's good. I like when you do the time lapse too.
Oh, thank you.
That's so cool.
Yeah, so it's a little faster.
Yeah. Well,
Mhm.
I always like those things when you kind of set it up and use like a GoPro or what do you?
I
How
use
do you
my
do it?
iPhone.
I found
Really?
And I just have basically like a video editor
Uh-huh.
that I go in and I can change the time of each frame.
Oh, okay.
So I literally go through each frame and I can speed it up or slow it down.
That's neat.
Mm-hmm.
That is very cool.
So, we were talking when we were moving from the kitchen to the table, and we were saying how passionate you are about what you do. And it's so nice to see nowadays, especially in physical therapy and just as providers as well. Like I can understand why you two work so well together.
And there's a physical therapist on every corner too. And so you have to be, you can't be ordinary. You have to be extraordinary. You have to strive to be that. That's because we're everywhere.
Now, what do you see in the future for physical therapy? Is anything changing? Is anything modernizing? Like,
Yeah, I do see some things that are changing. Of course, everyone is now on electronic medical records. That was a new thing. We used to have our 50-pound stack of manila folders. Those are gone. I think some of the operational things of, like, for example, now we're using a system called PT Now, where we can have patients, they have an app on their phone, and we can send them exercises to do. Of course, we instruct it in the clinic, but we can send that to their phone, and we can change the reps and the sets. It's cutting edge, and our company is a leader in that. And so we do have some of that stuff. We also have another system that we're going to be unrolling, or I should say rolling out, where we have, it's almost like a digital check-in, which is good because if you're short-staffed, you can have someone check in on an iPad with someone who's working at another office. And so it's just more patient-friendly. Of course, you'll never replace your front office, and you never should, because the
human
smile,
interaction.
the human interaction, that smile, that welcoming, you just, there's no screen that can do that. And so that'll always be a part of what we do, but we have this other ability to serve people better.
Right.
And more and more people are more apt to technology. I remember when we first went into private practice, cell phones were getting popular, so we were teaching people how to put in their, in case of emergency contact, their ICE contact. We see a lot of elderly.
Yeah, exactly.
And so we would teach them how to do that.
Yeah.
And so then it got to smartphones, and we were teaching them other methods of having safety things, because that's it's all about safety. And so now we're at that next phase. Of course, the young kids coming in, and anybody, I would say 35 and younger, it's all, they don't think twice about it.
Yeah.
It's just how it's life.
It's just normal.
Yeah.
Exactly.
Yeah, exactly.
Yeah. So
Wow.
those are some of the changes. We also have some new techniques that are in the last 10 years. Dry needling is commonplace.
Oh, yeah.
And so back in 2011, when I went to get certified, we knew of 2 dry needlers in the state. And so 3 of us went to get certified, and we were 3, 4, and 5 in the state. And then our company, Cutting Edge once again, bought the course and had the people from Colorado come down. We taught our entire company, all clinicians, how to needle. As a matter of fact, at our clinic. And from there, it went gangbusters. And of course, now it's taught in school. It's just, it's a mainstay of what physical therapy is.
And what are the benefits of dry needling?
It's incredible. You can work on myofascial pain, trigger points. So, and this is right back where our wheelhouses really, really overlap a lot. You have somebody with a really stubborn trigger point, you inject it, comes back a little bit. We can manage it long term, with a little dry needling, because all we're doing is putting an acupuncture needle, a filament in the muscle. It twitches, and then you're resetting. And so we have that to work with as well. And we're able to reach muscles that we couldn't get to before, which is really, really neat.
Wow.
Yeah. I mean, the best example of that is the subscap. We used to think, we're getting a subscap, and you have a fingertip underneath the scapula, right? You're not getting there. Well, now we can take a needle and get all the way underneath.
And what is the subscap?
It sits under the shoulder blade.
Oh, okay. Got it.
So there are some new things that we have over the past 10 years or so.
Oh, wow.
So,
Do you guys do cupping at all?
Oh, yeah.
Yeah.
Cupping. We have all the different scraping techniques. Absolutely. Yeah.
And what are the benefits of cupping?
I haven't really done a lot of cupping. It's from my staff that I work with who do a lot of it. You get it's almost like a local, like adrenaline type rush, if you will. You get a myofascial stretch because when you pressurize the cup, you can do static cupping where you just pressurize it, which can stretch around the edges, right, the fascia. And then my favorite, because it's been done on me and it feels amazing, is dynamic cupping, where you put some pressure on it with lotion and you're sliding the cup around.
Cool. I've never had that.
That is incredible. That's incredible. That's really neat. I don't do a whole lot of it. I'm very heavily manual therapy based. And I have my needles in my hands and specific corrective exercise. I think that's the key, because that's a lot of the long term and behavioral changes. But we have a couple things that are kind of new to things over the past 10 years. So.
Yeah, we had a client who came in yesterday, and I saw little marks on her back, and I said, "Oh, you had cupping done?" And she goes, "Oh yeah, I just left physical therapy." And I was thinking, wow, physical therapists are now doing cupping, because I feel like that is kind of more of an alternative
like a
type.
massage therapy.
Yeah.
Kind of niche.
Yeah.
Exactly. And I think the idea is to be as inclusive as possible, because everyone's different. Some people respond to one thing and not to others. And finding what that is and having more tools to work with is important for every patient.
That's so important. Like, patients are like, "Oh, what's the success rate with this?" I'm like, well, the reality of the situation is some people respond, some people don't, with every single thing we do in medicine, right? So it's about figuring out what you need, and with no guarantee, but if this doesn't work, then we'll go on to something else. Like, there's a laundry list of things we can do potentially.
I will never forget the first time I saw cupping. I was absolutely terrified. We had the sweetest little lady. She was well into her 80s, and she threw her back out, baking us a big pan of moussaka.
Oh my
And if you've ever felt a pan of moussaka, it is so heavy.
This is Greek,
It is
right?
Greek, and it is fabulous. She threw her back out, making us moussaka.
Oh, poor lady.
We brought her in, got her on a table. I'm working with her. We had her come in 2 days later. And in that day between, she went and got cut. and I had
Okay.
never seen it. So her back has this huge bruise.
Yeah.
What happened? This is probably in 2005.
Yeah.
Oh, yeah.
I was absolutely terrified.
Yeah.
I was beside myself.
Mhm.
I thought this sweet little lady got beaten or something. That was my introduction to cupping.
Oh yeah.
Yeah.
Maybe that's why I don't do a lot of it.
I had the
know.
same experience. The first patient I saw with these big circles all over.
Yeah.
Like, what happened to you? Like, oh, that's cupping.
Yeah.
I've got to look into this cupping
Mhm.
thing. I don't know about this. This seems a little crazy.
But the dynamic
But
cupping is
yeah.
really great.
That's cool.
Yeah.
Mhm.
And so, a little, horrified the first time I saw it, but it kind of grows
Oh,
on you.
for sure.
Mhm.
Wow.
Like, it loosens up the fascia, creates space.
Yeah.
Yeah.
So you get them in, you can, soft tissue,
Mhm.
myofascial release,
Mhm.
scraping, needling, and free up some of the myofascial guarding, and then you get into joints and get
Mhm.
joints moving and free up more mobility, and then everything goes from there.
Mhm.
That's great.
And so it's a neat approach. So,
Do you have any tips for just even young people, middle-aged, older people in order to take care of their bodies and, prevent pain or just, be able to kind of have bodies that are working properly?
take care of it.
Okay.
Mhm.
Take care of it. Had I known then what I know now, there are a few choices I'd make a little differently.
Mm-hmm.
But the reality, from my experience, is that I have some patients that come in who are in their 70s or 80s, and they're asking, well, why am I having all this pain?
Mm-hmm.
And why are things degenerating? I'm sure you've had this. And they say, well, I've done nothing.
Mm-hmm.
I've been so careful, I've done nothing.
Mm-hmm.
And then you have the person that's in the exact same shape,
Mm-hmm.
and they've checked all the boxes,
Mhm.
and they have stories and everything.
Mm-hmm.
So I've learned that I want to be that person that's checked the boxes, but there's a way to do it. It's all about moderation,
Mm-hmm.
and especially when we're working in chronic pain, we see a lot of other ramifications of chronic pain where there's a lot people, we have certain personalities, we see that it's all or none.
Mm-hmm.
And we really need to focus on moderation
Mm-hmm.
because, the tortoise or the hare win the race, be
Right,
the tortoise,
right.
check the boxes along the way.
Right.
And be that 75, 80-year-old or later who is breaking down, but has a great resume and has great stories to
Yeah.
share with their family and friends.
Yeah.
So that's what I want to do.
Yeah.
Right.
Mhm.
Awesome.
Well, for my birthdays,
Uh-huh.
usually on milestone birthdays, he always talks to me about looking ahead to a future decade.
Mhm.
Like, okay, now you're going to turn 30. You need to understand what the 40s might look like if you don't maintain yourself and
Yeah.
exercise and good
Yeah.
health. And then same with the 40 and on down the path. But you've always, every single time, he's like, make sure, because I see your future coming in
Absolutely.
if you
Yeah.
don't do the right thing and exercise in
Yeah.
a moderate sort of
Mhm.
pace and actually make it happen, because
Yeah.
sometimes it's easy in your busy life to push
Mhm.
exercise to the back,
For
right?
sure.
Or
Yeah.
whatever,
For sure.
or good food
Yeah.
choices like we
Yeah.
have here or whatever,
Yeah.
right?
Yeah.
And so
Absolutely.
I just know that he always asks me to look
Mhm.
forward to the
Mhm.
future
Well,
decade.
it's the people that took care of themselves in their 50s into
Oh,
their 60s who are better off in their 70s and 80s.
Yeah, we have
Yeah.
patients who come to the office, they're late 80s, early 90s, and they look 20, 25 years younger than
Yeah.
they are
Yeah.
because they took care of themselves,
Yeah.
made the right choices,
Yeah.
Control portion size, make sure
Mhm.
that they're eating whole foods and
Yep.
avoiding processed foods, limiting alcohol intake, all that stuff, and movement. Like they're
Oh,
in
yeah.
great shape. They're
Mhm.
physically just beautiful. Yeah.
I love when I get that patient that comes in who's in their 80s, thin, fit, they're going to exercise classes, they take
Yeah.
no medications.
Yeah.
They're my heroes.
Yeah.
I want to be them.
Yeah.
And they're the ones who they've traveled and they've had all the fun,
Mhm.
and they're meeting this friend for coffee and they're playing this card game, or it's
Yeah.
fun,
Yes.
and they're just full of life.
Yes.
Absolutely.
And of course, they tend to be. It kind of carries into the patient next to them,
Oh yeah.
Mhm.
who isn't there. Like, how do they do that?
Mhm. Mindset.
Yeah,
Mhm.
mindset
Exactly.
starts there.
Exactly.
Where you said it starts
Yeah.
right there.
It
Well,
is
yeah.
mindset for sure.
But like you said, it's also like, we're telling Cheryl, like, where do you want to be, or how do you want to be 10 years from now? Look at the
Mhm.
next decade.
Yeah.
The choices you make today will affect that. And it's about being
Exactly.
present in the moment, but making the right choices
Yeah.
for you.
Mhm.
Yeah.
We also have in my case, I have, friends who I see doing that who are 10 years older than I. One of my dearest friends is exactly 10 years older. I want to be him. And ever since I moved to the Valley and went to work with him,
Mhm.
I've always said, I want to be him.
Right.
And it's true. You know, and every so often I see him out mountain biking. And,
Oh yeah.
you know, we work with the same company, and
Mhm.
I see him out on the trails, and 10 years old, they're tearing it up.
Oh yeah.
Mhm.
You know,
No, I have a friend like that too. It's one of our guy friends, and he'll be 60 next year,
Mhm.
and his physique has
He
not
looks
changed
40.
since he was
Yeah.
totally.
same
It's
story here.
amazing.
Same thing. Mhm.
He's so disciplined with his lifestyle, his choices,
Yep.
and we're
But
like,
it's
well,
a
we all want to be.
moderation as well.
Yeah, him when we want to grow when we grow up.
Yeah.
Like you're our role model, man.
Isn't that funny? We get to this stage
Uh-huh.
of life where it's like,
Yeah.
I guess I'm grown up, but I really don't want to know what I want to be when I grow up.
Oh, exactly.
Yeah.
For sure.
Mhm.
Yeah.
But fortunately, we're in a good group.
Mhm.
Mhm.
Yeah.
Well, I even look at my grandmother, my Oma. We were just talking about her, and you know, I see her, and she is what, 84? I think she's 84, going to be 85 in next July, and she is the epitome of health. I mean, and she doesn't do anything drastic. It's all with what she's consuming, what she's eating. She's originally from Germany. So she grew up eating a lot of vegetables, mainly more of a vegetable diet. She doesn't eat hardly any red meat, more of, light poultry, a lot of fish and vegetables. And then she walks every day. And so she's not completely exerting herself, but she's walking and she's getting out, and she is so healthy, and she lives and she's sharp, in her mind, and she lives a pain-free life, and she's had some other health stuff that she has completely overcome just by living a balanced life.
I think walking is also huge.
Yeah.
Walking is key. It's one of the best things for
Yeah.
low back pain.
Exactly.
It's one of and with chronic pain, we get a lot of patients who come in with they have this diagnosis of fibromyalgia.
Okay.
Now, I'm the first to say I can't identify exactly what it is.
Yeah.
I don't know what it isn't. But when a patient tells me they're in pain, since I'm on their page, they have pain. There's no question about that. They have pain.
Mhm.
And what we've learned is that they lack some sympathetic nervous system control.
Mhm.
And walking also helps to gain some of that control. And walking is great. I mean, some of the most chronic patients who come in with just diffuse pain,
Mhm.
20 minutes of good brisk walking every day.
Yeah.
And it increases blood flow.
Uh-huh.
And when you're stagnant, the blood doesn't flow, and you just build up toxins, right?
Yep.
So walking, you increase blood flow. Where
Mhm.
blood goes, oxygen goes. When blood flows away, it takes all the bad stuff with it. So
Yeah.
all the toxins float away too. So
For sure.
yeah.
It's great for the mind too, especially getting out in nature, and it helps to reduce stress and just kind of ground you as well.
Absolutely.
Well, thank you so much for coming over
Absolutely.
and having this amazing conversation with
Thanks for having us.
and-
Yeah, thanks
Yeah,
for
really
having
great.
us.
So
It's
welcome.
really, it's been so
Yeah.
lovely, and this
Yeah.
food is so excellent.
Oh, thank
It's just
you.
really, it's wonderful.
Thank you. Yeah. So, and then if people have questions, do you have a website that they can find you?
We do.
Mhm.
It's www.foothillsrehab.com.
Okay, wonderful.
And they can search the Old Town Scottsdale location to find me specifically.
Okay,
We have an information line.
okay.
And
Oh, great.
that message will get to me. And of course, being part of a larger company, we have specialists in different areas that I make sure to utilize.
Okay.
So I have an area of specialty in one, but we have others that have other areas that they work, and I refer to them as well.
Well, thank you, and we will be looking forward to our next visit.
Can't wait.
Yeah.
It's going to be great.
Yeah.
Great. Thank you guys.
Thank
Okay.
you.
Thanks for having us.
Yeah, of course.